Hi, how are you doing today?
I'm good. How are you?
Good. My name is Emily. I'm going to do a quick assessment on you, okay?
Okay.
It's going to be a full head-to-toe assessment, and I'm going to identify any findings that I find along the way, okay? Can you verify your name and date of birth, or your initials and date of birth?
TLC, May 30th, 1964.
Very good. So I'm going to go ahead and pull this curtain for privacy. I'm going to make sure your environment is safe, which it is. I'm going to go ahead and wash my hands and put on some gloves. Alright. And I'm going to put on these gloves, okay? And can you tell me where you are right now?
At home.
Okay, good. And what time of year is it?
Winter.
Good. And you already told me your initials and date of birth, so you are alert and oriented ×4. Your speech sounds clear to me, and you don't seem to have a flat affect or anything. It seems appropriate for the situation. And you are not slurring your speech at all. Your vital signs that the CNA had told me are 117/76, 92. Your pulse oximetry was 98% on room air, and your temperature was 97.7. So those are all perfect and within normal limits.
Okay.
Are you having any pain right now?
No.
So how would you rate it on a scale of 0 to 10?
0.
Okay, perfect. All right, so I'm going to go ahead and start your assessment, okay?
Yes.
All right. So I'm going to be looking at your head for I'm going to be looking at your head for symmetry and any bumps and bruises. Okay. And I don't see anything. Have you had any recent trauma to your head?
No.
Okay, good. I'm going to feel your ears for symmetry and make sure there's no deformities, which I don't see any. I'm going to feel your lymph nodes, and I don't feel any swelling at all. I'm going to make sure your trachea is midline, which it is. Have you had any troubles with your nose recently?
No.
Does you feel like it's obstructed or anything for your airway?
No.
Okay, good. And it looks straight to me, so no deviated septum. I'm going to take a look at your eyes. Your conjunctiva looks pink and your sclera is clear. No, it doesn't look like there's any irritation to them. Can you open your mouth for me and say ah? Alright, your throat looks good. There's no swelling or anything in there. It looks symmetrical. Your mucous membranes are pink and intact and moist, which is all normal. Do you wear dentures?
No.
Okay, so you have all of your teeth. Have you had any difficulty swallowing?
No.
Good. Alright, so I'm going to go ahead and do your eyes, okay? I'm going to shine this bright light in your eyes and just make sure that they're both equal. Very good. So your pupils are equal and round and reactive to light and accommodation. Okay. Can you close your eyes for me? Where do you feel my fingers at?
On my forehead.
What about now?
On my chin.
And what about now?
My cheeks.
Okay, good. Alright, I'm going to grab something. Can you close your eyes again? I'm going to put something in front of your nose. Can you close one nostril? And what do you smell?
It smells like a vanilla lotion.
Okay, good. And the other side? You smell the same thing?
Yes.
Okay, good. Alright. And can you close your eyes tightly for me? And open them? And raise your eyebrows? Good. And can you smile? And can you show me your teeth? Good. And can you puff your cheeks out? Good. And can you put your shoulders up against mine? There you go. And then turn your face against my hand. Good. Alright. And you've been swallowing okay, you said, right?
Yes.
Okay. And I would test your gag reflex, but I'm not going to make you gag right now.
Okay.
But do you feel like you have a pretty good gag reflex?
Yes.
Okay, good. Alright. So I'm going to go ahead and listen to your lungs, okay?
Alright.
Alright, deep breath. Alright, your bronchial sounds on the top. Deep breath. Bronchiovesicular in the middle lobes. And vesicular in the lower lobes. Have you had any trouble breathing recently?
No.
Have you been short of breath at all?
No.
And it doesn't look like you're using any accessory muscles to breathe, and your abdomen or your shoulders. So I'm going to go ahead and take a listen to the front, okay?
Alright.
Deep breath for me. Can you sit up nice and straight? Alright, good. So I don't hear any adventitious sounds. I hear the normal sounds for all your lung lobes. I'm gonna go ahead and take a listen to your heart sounds, okay? I'm gonna listen to your apical area, your pulmonic, the NURS point, your tricuspid, and your mitral valve. Alright, I don't hear any abnormal heart sounds. I hear the S1 and S2 are clear and they're not distant. I don't hear any murmur or anything. I'm going to go ahead and feel your pulses, okay?
Alright.
Alright, your radial pulses are both 2+, and your pedal pulses are the same, and I don't feel any edema. And your capillary refill in your lower extremities is less than 3 seconds, and your upper extremities are less than 3 seconds as well. Alright, and so now I'm going to go ahead and do your, I'm going to do a quick GI assessment real quick. When was your last bowel movement?
This morning.
Good. And was it normal consistency?
Yes.
Okay. And have you been tolerating your meals okay?
Yes.
No nausea and vomiting?
Mm-mm.
Okay. And so I'm going to go ahead and take a look at your belly. It looks good to me, and I don't see any obvious bumps or bruises or anything. And I don't see any striations in your GI tract. So I'm going to take a listen. Alright, your bowel sounds are active in all quadrants, and yeah, they're active in all quadrants. I'm going to go ahead and feel. Any pain when I'm palpating?
No.
Okay, good. And how's your urine been recently?
Good.
Good? Have you been avoiding, how many times a day do you avoid?
At least 6 to 8.
Okay, and what color has it been?
It's a pale yellow.
Okay, and has it been clear or cloudy?
Clear.
Okay, good. I'm going to go ahead and palpate your bladder. I'm going to feel for any distension, and I don't feel any. Okay, good. And through the test, I've been looking at your skin, and I don't see any bumps or bruises or anything to be concerned about. I don't see any areas of redness or rash. It's dry and intact, and it's nice and warm, which is all good. And I don't see any breakdown or anything. I'm going to go ahead and assess your skin turgor, and it's good. It goes down in less than 3 seconds. Perfect. Okay, so I'm going to go ahead and have you, actually we're going to do this first. So can you pull up against my hand? Good. So your lower extremities, your muscle strength is 5 out of 5, so that means it has a good tone and strength. I'm going to go ahead and have you stand up. And grip my fingers, please. Okay, good. There we go. Good. And good. All right, I'm going to have you hop on one foot. Good, and then the other one. Good. Alright, I'm going to do the Romberg test on you, which means you're going to close your eyes with your feet together, and I'm going to see if you sway or anything. So go ahead and close your eyes. Okay, good. You're starting to sway a little bit, but that's okay. It's normal to sway a little bit when you close your eyes and you have your feet together. Can you do your hand, put your finger on my finger and go back to your nose, back and forth, and then the other finger. Good. Okay, and then I'm going to have you take your hands and go like this. Very good. So your muscle strength overall is a 5 out of 5, which is perfect, and that's what we want it to be. So you can go ahead and have a seat. Okay, well, do you have any questions for me?
I don't, thank you.
Okay, well, I'm going to go ahead and wash my hands again and clean my stethoscope. I'm going to make sure you're safe in your environment, which it looks like that you are. I'm going to pull your side rails up if you had side rails, and make sure your call bell is within reach, and I hope that you have a great day.
You too, thank you.
Thank you.